Every year, millions of people worldwide are affected by hospital-acquired infections, or HAIs. These infections occur while receiving treatment in a healthcare facility and can lead to severe complications, but the good news is, they are preventable. Hey everyone, Dr. Mike here, and I'm partnering with 247 Care Solutions to bring you the latest information on protecting yourself and your loved ones. Today we're diving into the latest strategies to prevent HAIs updated for 2024. Let's be real for a second, nobody wants to think about getting sicker when they're already in the hospital. But the reality is, hospitals are where people go to heal, and sometimes that means being exposed to some pretty nasty bugs. We're talking about bacteria, viruses, fungi, and other pathogens that can cause infections, especially when someone's immune system is already weakened. These aren't just sniffles, guys. We're talking about serious stuff like bloodstream infections, which can be incredibly dangerous. Then there are urinary tract infections, which are super common in hospitals, especially with catheters. And let's not forget pneumonia, a lung infection that can be really tough on patients who are already struggling to breathe. Now I know this might sound scary, but knowledge is power. The more we understand about HAIs, the better equipped we are to prevent them. Together, we can make hospitals safer for everyone. Alright, let's talk about the MVP of infection prevention: hand hygiene. It's the simplest, most effective way to stop the spread of germs, and that includes those nasty HIs. We're not just talking about a quick rinse here, we need to be thorough. Healthcare workers, I'm looking at you. Wash your hands before and after every single patient contact, no exceptions. And patients, don't be afraid to speak up. Remind your doctors and nurses to wash their hands, it's your health, you have every right. Use warm water and soap and lather up for at least 20 seconds. Make sure you get under your nails and between your fingers. And if you're in a pinch, alcohol-based hand sanitizers are your best friend. Hand hygiene is a game changer. Let's make it a habit, people. Remember, hand hygiene saves lives. It's a team effort, so let's all do our part. Alright, let's talk about another crucial aspect of infection prevention: personal protective equipment, or PPE. PPE is a barrier between you and those harmful pathogens that can cause HAIs. Imagine this: gloves, gowns, masks, and face shields acting like a force field, protecting you from those microscopic invaders. When used correctly, PPE significantly reduces the risk of transmitting infections. But here's the catch: using PPE correctly is key. First, always follow your facility's guidelines, they're there for a reason. Second, make sure you're using the right PPE for the situation. And for my fellow healthcare professionals, never, and I mean never, reuse disposable PPE. Treat used PPE like biohazardous waste, because that's exactly what it is. Remember, PPE is only effective when used and disposed of properly. So let's suit up responsibly and protect ourselves and those around us. Chapter 4. Cleanliness is king. Environmental cleaning and sterilization. Hospitals are busy places and germs can linger on surfaces. That's why environmental cleaning and sterilization are non-negotiable in our fight against HIs. Think of it like this: every doorknob, bedrail, light switch, and medical device has the potential to harbor those sneaky pathogens. That's why regular cleaning and disinfection are so important. We're not just talking about a quick wipe down here. We need to be thorough and use hospital-grade disinfectants that can actually kill those germs. We're now seeing some amazing technologies that are taking sterilization to the next level. UV light disinfection, for example, uses ultraviolet light to zap those germs right out of existence. And then there's hydrogen peroxide vapor systems, which are incredibly effective at sterilizing entire rooms. Remember, a clean environment is a safer environment. So let's all do our part to keep our hospitals sparkling clean. Chapter 5. Antibiotics aren't always the answer: antimicrobial stewardship. Let's talk about antibiotics, those powerful drugs that have saved countless lives. But here's the thing: antibiotics are often overused and misused, and that's a huge problem. Every time we use antibiotics unnecessarily, we're giving those bacteria a chance to adapt and become resistant. And that, my friends, is how we end up with superbugs like MRSA and C. difficile, which are much harder to treat and can be deadly. That's where antimicrobial stewardship comes in. It's all about using antibiotics wisely and only when they're truly needed. It's about making sure patients are getting the right antibiotic at the right dose for the right duration. And patients, you have a crucial role to play too. If your doctor doesn't prescribe antibiotics, don't pressure them. Trust their judgment. And if you are prescribed antibiotics, take them exactly as directed. Don't stop taking them early, even if you start to feel better. Remember, antibiotics are a precious resource. Let's use them wisely to preserve their power for future generations. Chapter 6. Shields up, vaccinations and patient screening. Let's talk about two powerful tools in our fight against HAIs: vaccinations and patient screening. First up, vaccinations. We all know vaccines are like giving your immune system a sneak peek at a virus so it can be ready to fight back if it ever encounters the real deal. But here's the thing, vaccinations aren't just for kids, they're crucial for adults, especially those who are at higher risk of infection, like hospital patients. We're talking about vaccines like the flu shot, which can help prevent those nasty influenza outbreaks that can sweep through hospitals. And let's not forget about the COVID-19 vaccine, which has been a game changer in protecting both patients and healthcare workers. Now onto patient screening. By screening patients for potential infections when they're admitted, we can identify those who might be carrying those multi-drug resistant organisms, or MDROs. Early identification means we can isolate those patients and take extra precautions to prevent the spread of infection. Remember, vaccinations and patient screening are like having a force field around the hospital protecting everyone inside. So let's roll up our sleeves and get those vaccines, and let's support hospitals in their efforts to screen patients and keep infections at bay. Chapter 7. Knowledge is power, educating staff, patients, and visitors. We've covered a lot of ground today, but here's the key takeaway. Preventing HAIs is a team effort. It's not just the responsibility of doctors and nurses. Everyone has a role to play, from the cleaning staff to the patients themselves, and yes, even the visitors. That's why education is so important. We need to make sure that everyone who steps foot in a hospital understands the basics of infection prevention. Healthcare workers need to be up to date on the latest guidelines and best practices. Patients and visitors need to know how to protect themselves and others. Imagine this: hospitals where hand hygiene is second nature, where everyone understands the importance of PPE, and where patients feel empowered to speak up if they see something that doesn't seem right. We need to create a culture of safety in our hospitals, where infection prevention is everyone's top priority. So let's keep those conversations going. Let's ask questions, share information, and empower each other to be advocates for our own health and the health of those around us. Remember, knowledge is power. The more we know about HAIs, the better equipped we are to prevent them. So let's keep learning, keep sharing, and keep those hospitals safe. Chapter 8. The future is now: emerging technologies in infection prevention. We're living in an age of incredible technological advancements, and the field of healthcare is no exception. We're seeing some truly groundbreaking technologies that are transforming the way we prevent HAIs. Imagine this: AI-powered monitoring systems that can analyze data in real time, detecting potential outbreaks before they even occur. We're talking about sensors that can monitor things like hand hygiene compliance and even identify patients who are at higher risk of infection. We're also seeing wearable sensors that can track vital signs and detect subtle changes that might indicate an infection is brewing. And we can't forget about the incredible advancements in antimicrobial surfaces and coatings. These are materials that are designed to prevent bacteria and viruses from sticking around. These technologies are not just futuristic fantasies, they're already being implemented in hospitals around the world. The future of infection prevention is bright, and it's powered by innovation. So let's embrace these advancements and work together to create a safer and healthier future for everyone. Outra joined the fight preventing HAIs together. So there you have it, folks. We've covered a lot of ground today, from the basics of hand hygiene to the latest cutting-edge technologies. But the message is clear: preventing hospital-acquired infections is a shared responsibility. By staying informed and following these practices, we can create safer healthcare environments for everyone.